here from the Pediatric Unit at the hospital. Dr. Scoggins, welcome back to KSJE. Nice to have you here.
Thanks, Scott. Glad to be here.
Thank you for being here. Also joining us, one of your colleagues, Melanie Stout, is here as well from the Pediatric Unit. Melanie, welcome back to you. Good to have you here.
Thank you for having us.
Thank you very much. You two have been busy since you were last with me, expanding a little bit the services that you offer and doing more with pediatrics, of course, in the unit there at San Juan Regional Medical Center. And so we want to talk about that, but I guess first on my list is maybe what's everyone may be talking about, which is the news of measles in the country and in the county and in the state. And I know that's something that you're watching, Dr. Scoggins, and I know you're a big advocate of vaccines and vaccinations. And so I think at the current count, San Juan County has maybe one case of measles that was maybe contracted somewhere else by a child.
Yes, absolutely. So that is my understanding as well, as far as what's been published from the Department of Health. I will say from the pediatrics standpoint here at San Juan, we started vaccinating over 2 months ago, started vaccinating children 6 to 12 months of age. To kind of head this off because we knew it was probably coming our way. And that I know of, one case in San Juan County, and we're stood up at our clinic to address kids who either have symptoms of measles, have been tested. So we do have a plan for how not to expose others.
Got it. Very good. And again, the importance, I know I'm preaching to the choir here, but the importance of vaccinations and getting children vaccinated against things like measles and some of these other common childhood ailments that we hear about.
Yeah, absolutely. Don't discount the important role vaccines have played historically. Whenever parents have questions about vaccinations, I point them to a handful of historic books, which I'm happy to provide a list of, so they can kind of read about why we have these vaccines and the impact they've had on childhood mortality and survival. Vaccination wasn't just invented in a lab by an evil scientist some years ago. This is a time-tested and actually started with a simple observation in provincial England. I want to say it was the late 1800s. I always get the date wrong on that, but the late 1800s.
But a long time ago.
A long time ago. Yeah. Where Edward Jenner
at least
noticed,
over 100 years ago.
Well over 100 years ago. And basically it was an observation that milkmaids who got cowpox did not get smallpox.
Right.
We confuse the pox occasionally. Yeah.
Right.
But
there was something in that kept them from getting sick.
Absolutely. So that thus began the process of vaccination. Vaccinia being cowpox. So we vaccinated with cowpox to protect people from smallpox, because the consequences of smallpox in those days were either death, blindness, horrible disfigurement. There was no good outcome. And that's true of a lot of the vaccine preventable illnesses. Take polio from recent history.
Right, and that's less than 100 years ago, but still the results are just as amazing, I think. And when the polio vaccine came out, a little bit before my time, but still I know folks were celebrating that and couldn't believe that this was an amazing kind of end to this horrible polio that was affecting lots of children nationwide at that time.
Right, yeah, you see black and white photographs of people lined up around multiple city blocks waiting to get their kids inoculated, because the disease for the first time kind of crossed over socioeconomic lines and affected everybody. Go look at some pictures of iron lung wards, which thank God we don't have to have on our pediatric unit.
Yeah. Right.
But yeah, go take a look at some iron lung wards, just for a quick reminder, in, like you said, about 50 years.
Yeah, exactly. Yeah. Even the president had been affected by polio. FDR
right.
is what comes to mind. But getting back to measles, and I just want to touch base, and then we'll move on to something else too, is just to remind folks, because it hasn't been in the news all that much until just very recently. What does measles do to a child if they contract measles? What is the, physical effects of that on a child?
Absolutely. Well, thankfully, if you're vaccinated, even partially vaccinated, the likelihood that you're going to have significant illness from measles is pretty small. What we're worried about is what's possible, and compared to lots of other viral infectious diseases, this one is among the most transmissible. But compared to other viral infectious diseases, measles can cause suppression of your immune system, so your ability to fight off other infections for a good period of time, at at least 6 to 12 months is diminished significantly. Kids can also have swelling of the brain that's irreversible and can result, in many cases, in death. The thing we worry about up to 5 years after acute infection is something called SSPE, or subacute sclerosing panencephalitis. And that literally involves a swelling of the brain that's nearly impossible to stop.
So if my child gets measles up to 5 years after that, they could still be at risk of this?
Right.
I see.
Exactly. So that's the scariest of the outcomes.
Sure.
For most kids, it will be a nasty cold with a really ugly, scary-looking rash. The case here in San Juan County, thankfully, the child in question, the index case, if you will, was better in about 36 hours. But it's important to note she did have her first dose of vaccine about a month before getting sick.
Gotcha. Okay. Important to note. And again, with all the information coming out from the press nationally about vaccinations and vaccine guidance and things like that, I guess the other thing I wanted to ask you about is it important to just have that relationship with your pediatrician for parents to maybe, if you have questions about conflicting stories in the news or what have you, I guess the thing to do maybe to reach out to your pediatrician to say, hey, what do you think is best for my kid, for my family, with all this that's going on?
Yeah, absolutely. I mean, I would say all of us at San Juan Pediatrics go out of our way to keep a good a line of communication with our patients and really build that trust over the time we care for kids. And this is one of the most important things that we can do for your child, is make sure they're vaccinated against some of these horrible diseases. Haemophilus influenza, or Hib, can cause swelling of the airway that's often deadly. It's called epiglottitis. It can also cause meningitis. So a lot of these vaccines that we administer at the ages we administer them are life altering. I mean, they will make sure that your child grows up healthy.
Right.
And we gave, just for example, we gave about $2 million worth of vaccination last year, about 20,000 doses of vaccine, one of the highest in the state. I don't know exactly where we fell.
That's a local number? That's a local statistic?
That's from our clinic alone. So that doesn't even count PMS and the excellent family practice groups we have in town.
Wow.
So lots of vaccine being given here, and the number of side effects is basically nil, other than a little bit of localized pain at the injection site, which, as you can imagine, would be fairly common, and some low-grade fevers.
Right.
Yeah.
Gotcha.
And I always remind people that all of our providers' children are vaccinated, and my joke is my kids are mostly normal except they're mine.
Okay, there you go. Fair enough. Fair enough. Okay, and you were saying too that our vaccination rates in San Juan County are fairly high, which I guess is also a good thing, because when we talk about herd immunity and things like that, and just kids interacting with other kids, the chances are that those other kids have been vaccinated as well. Because what are our rates these days?
Right, absolutely. We're somewhere around 97%. So we are above what you would need for herd immunity in the case of measles.
Gotcha. And that's good.
That's excellent. So that means that this one case that has made its way into our county will hopefully not spread.
Right, which is what you're watching.
Right.
So, very good. Okay. Now, let's talk about the Pediatric Unit at San Juan Regional Medical Center. I know it's a topic that's near and dear to your heart, both of you, and there's been a lot of changes and a lot of improvements and a lot of investment, I think, too, to bring in more specialists and more nurses that specialize in pediatrics and things along that line. And that's an important message, I think, for folks to know, that maybe if they, in the past, maybe had a sick child or grandchild that maybe they had to go out of town to have that dealt with, but now chances are they can be helped right here in San Juan County.
Yeah, absolutely. Yeah.
So we have a 14-bed pediatric specific unit at the hospital. So we can care for anyone from 0 age,
Right.
like 1 day. So if they're discharged from the nursery and they have to come back, they'd come to our unit, all the way up to 17 years of age. So that spans a lot of developmental stages. So our nurses are trained in childhood development, how to take care of kids when they're at their worst, right? The parents, the grandparents, all of that. They are PALS certified, and then also ENPC, which is Emergency Nurse Pediatric course. So that really focuses on the assessment. We may get a kiddo that looks a certain way, and then 6 hours later sort of gets a little bit worse. So we want to be able to provide the care they need to the child and to the parents and reassure them. So.
Nice. Right. And that is different than maybe dealing with an adult patient, because we all know adults have their own set of issues, and there's a whole other set of floors in the hospital dealing with those. But for pediatrics, that specialized training, I guess, is really important to maybe identify some of these things in children and teenagers and tweens that you're talking about.
So that's a good point, actually. Yes, they are not just small adults. They have a lot of different needs, and we have a lot of kids who have chronic diseases in our community. So we also provide pediatric outpatient services on our unit. So
Okay.
let's say we have a kiddo that sees rheumatology in Denver. And they need some medication. They don't have to drive to Denver to get that medication. We can give that to them on the unit. So yeah, it provides that connection. We know these kiddos, and they're relieved and they trust us. That's the biggest thing.
Right. But certainly there's a lot of difference between a child who's a toddler than a child who's 16 years old.
Absolutely. So lots of different diagnoses. We have recently partnered with Inspire Heart and Christy Clugston. We are going to be doing some art therapy. We kind of already started. We have something called Inspiration Station. It's a fully loaded art cart to take the stress off of being in the hospital for whatever reason. And we hope to sort of all the kids that have to come to our hospital, if they're in the ER, maybe we can go see them and do some art therapy with them. So we're excited to do some of those things.
Gotcha. And these things would be kind of age specific, maybe, for the kids in the unit.
Absolutely, yeah. So you've got maybe you have a 3-month-old that we're taking care of, and parents are young, perhaps, and they're worried. Maybe the parents might want to do some art therapy, and
Sure.
All the way up to a teenager who just needs some time for us to kind of sit with them. So much can be done, and our peds nurses just love that. That's why they became nurses. So.
Right. Very good. And Dr. Scoggins, I want to ask you, similar to pick up on what Melanie Stout is talking about here with the specialized nurses who are here, your other pediatricians who are working on the unit and things like that. That's got to be important, again, as you deal with these kids who are coming in all ages and with all different types of problems and situations that need attention.
Absolutely, yeah, and we've made it our mission collectively between the pediatric hospitalists who are pediatricians specializing in hospital care, nursing staff, and respiratory therapy. I want to put a big plug in for them because so much of what winds kids up in the hospital is respiratory illness, particularly through the winter months, although this year it went on quite a bit longer. I think we're just kind of slowing down now. But yes, a specialized team of pediatric hospitalists who rely heavily on our nurses and respiratory therapists. So we've assembled a great team, a lot of training, and at this point a fair amount of experience taking care of kids in community hospitals. If people will remember, shortly after COVID, children's hospitals were overflowing with business, and that was in large part because there was so little business during the COVID years that a bunch of community pediatric units shut down. So I and my team that I referenced are extremely grateful to the hospital for continuing to support that service line and make sure that pediatrics is invested in and robust and everybody's well trained.
And that doesn't just happen overnight, at least I don't think it does, to build a team with the experience that you have done, right? That takes a lot of efforts to recruit and to keep people on that floor and in that unit.
Absolutely. Yeah,
So
absolutely.
You end up having to, and I'm glad you mentioned respiratory therapy. We've done some work, for example, with respiratory scoring tools and high flow nasal cannula, where these patients are actually in intermediate level care. And so we can safely care for them with RT and make sure they're okay. We don't have to transfer them out to another hospital. But that comes with a lot of competency and skills training that we provide every year.
Right. And is that part of kind of the goal as you build this team or have been building this team to try to offer more services locally than the need for folks to have to travel outside of the community for the care that they're looking for their kids?
Yeah, absolutely. Like I said, I personally have my children here in this community. Melanie does as well. And the number of people that work for the hospital, All of our kids are here in this community, so we want to do everything we can for the entirety of the four corners, really, to make sure we can keep these kids here safely, have good collaboration with specialists. And I'll point to an ongoing project now that involves a telemedicine cart with the neonatologist at Presbyterian, who provide our support for our NICU. So we've been able to carefully and safely care for much younger babies here. So our experience level is growing, and we are well supported, albeit remotely, by specialists.
So they're newborn babies who maybe in the past would have been transported to another facility somewhere else with all the possibility of complications that involves, but now they're able to stay here in this pediatric unit with the consultation from these folks at the larger hospitals.
Correct. Yeah, and in the childbirth specific, so those babies would stay upstairs in our special care or level 2 nursery.
I see. That's right.
But as Melanie mentioned, if as those babies are discharged, sometimes they do have trouble with elevated jaundice levels. God forbid, occasionally there's a child that becomes septic, and so we'll bring them back to the pediatrics unit. So our pediatrics nurses are comfortable taking care of neonates also. There's a lot of overlap between the two areas.
Right, I would think so. That's true. And so, but that is something that now you're able to deal with and have that child at the hospital rather than 200 miles away.
Right.
And so that's
and loading a baby on an aircraft is no cakewalk, as you might imagine.
Right. No, I'm sure for the baby or the parents, right,
Right.
who are having to deal with transportation to get to see their newborn or whomever it is, right? So that's an important thing. And so moving forward with this pediatric unit and some of the improvements that you have made, what's next, I guess, on your wish list of things to either offer the community or another specialty to maybe add to the team or things like that? Melanie Stout, you mentioned the art therapy, which is just getting going. So that's one thing that's happening. What else is on your wish list?
I think we would like to go out to the community and kind of, a lot of our amazing family practice clinics, just make sure that if they have a kiddo they want to send over, sort of talk to our peds hospitalist, maybe create a line that they can call to talk with them directly. Would a direct admission be an option for this child, or outpatient services type thing? So really expanding on that, yeah.
Yeah, is that still a challenge of making sure everyone, your colleagues in the community, know about the services that you offer?
Yes, a little bit of a challenge. We're post-COVID, and we're waking back up, and we want to serve the community in a way that we can. We have the support of our organization, so we'll be doing some marketing coming up regarding that.
I don't know why these pediatricians don't just listen to the radio every morning while they're eating their bonbons and just reviewing their emails, right? Dr. Scoggins, that's like your mornings, right? Isn't that what you do?
Sounds about right.
Yeah, sure.
Right. Bonbons,
yeah, exactly. That's true. Very true. But getting the word out about all the things that you are offering and that type of thing. Dr. Scoggins, anything about adding more to your team or things like that? Are you pretty happy with the folks that you have, or is there always room to add more?
I'm definitely happy with our team. I think we've got a great lineup of pediatric hospitalists. I would say high on my wish list is continuing to collaborate with specialists so we can increase the number of children and disease presentations they may have here in town. And with the reality of telemedicine is a lot of these conditions that we previously had to transfer, we can start caring for them here. The one that immediately springs to mind is type 1 diabetes.
Right.
So for new onset type 1 diabetics, at the moment, we're having to transfer them to a tertiary care pediatric center so they can have a pediatric endocrinologist, diabetes education, and everything that goes into that with a new presentation. If we can collaborate with the appropriate specialist, diabetes educator, and have that done through telemedicine while we care for them here, that's high on my list.
Right, very true. And we see a higher than usual or higher than average number of cases here. Are we about average? What would you say?
I think we're probably about average.
Okay.
Just based on what I know.
This is type 1, but type 2 is a different story for adults. We know that.
Well, type 2 even for kids is a growing issue. So I know that's not the subject of today's talk, but we do have we are shifting some resources in the outpatient environment. We actually have a now board certified obesity medicine pediatrician, Dr. Kimball, out of my office. Who's going to be working with the Metabolic and Bariatric Institute. So Dr. Boyd, Megan, they will be working together to try to help solve this problem at a community level.
Nice, nice. And we've had them on the show before too, so they've been
Indeed.
talking about the work that they do, which is amazing. And so that's great to know as well. And from a regional standpoint, I would say, again, getting the word out to other doctors even outside of San Juan County that these things are offered, because it is San Juan Regional Medical Center. And so I know your audience and your patients come from beyond the borders of San Juan County, and by design, I think, the hospital builds teams and services to serve the greater, larger Four Corners community, and pediatrics is no different.
Yeah, absolutely. So part of this marketing campaign Melanie referenced is we do want to reach out to some of our Four Corners area hospitals and let them know, hey, maybe not all your kiddos need to go to Albuquerque per se. We could probably safely care for them closer to home here at San Juan.
Right, which would be amazing, and a great service to patients and their parents too.
Mm-hmm.
I would think so. That's important as well. To recap, we just have a couple of minutes remaining this morning, but again, vaccines still important, very important.
Absolutely.
Yes.
Melanie?
Very important.
Yes.
Yes.
Okay. All right. Very good. And if folks listening to us, again, would like more information about the services that are being offered on the pediatric floor at San Juan Regional Medical Center, or to learn more about some of these other things that we were talking about, what's the best way to do that?
They can call the pediatric unit. They can call me. I'm the manager of the pediatric unit, so
Right.
they could call me directly. They can call the hospital, and there'll be more to come as far as marketing. So
Okay.
we can have a number.
Very good. And I still consider the pediatric unit a bit of a newer unit with the remodel, but it's
That's
now been a
beautiful.
couple of years, I think, hasn't it, Dr. Scoggins?
I was just going to bring that up.
Okay.
So thanks again to the San Juan Medical Foundation, all the community donors for the Building Wings campaign. The unit is great. We get great feedback. It's livelier. It's brighter. I think it's a great healing environment, and we're looking to actually continue to add some additional fun things to help lessen the blow of being in the hospital.
Sure, right.
But yeah, it's been a tremendous lift for morale. I mean, we have one of our night nurses, Jessica, that makes the most amazing paintings with dry erase chalk.
Yes, she
Okay.
puts them on all the windows to the rooms, and she'll have
decorates
themes
for all the
Yeah,
holidays, and so people from the entire hospital walk through the peds unit when they're feeling a little bit low, and
Nice.
it really gives them a nice
Those
lift, I think.
those adult doctors are like, I'm just passing through. Yeah,
Nice.
they needed a little
Yeah.
happiness.
Right.
Indeed.
Very good. Well, it's been great to see, and a great addition to the hospital, of course, with that remodel. It's something that I know has been there for a long time, but the remodel certainly freshens everything up and
Absolutely.
gives it kind of state of the art equipment and staff, as we've been talking about, and the team that's all there and ready to go. So I appreciate you both coming in this morning to share the work that you do in the community and for our kids. Thank you both very much.
Absolutely.
you,
Well, thanks
Scott.
for helping us get the message out.
You
Yeah,
bet.
thanks.
You're